KbPort's BPSim, the industry's most advanced patented analog sphygmomanometer simulator, can be used as a skills trainer or used to add realism to high-fidelity simulations or standardized patient scenarios. Starting BPSim cuff instructions is as simple as pushing a button on your own mobile device. Open the BPSim app, tap the device you want to program, and select Run Simulator. Utilizing the cuffed control menu, configure your BPSim heart rate, systolic pressure, and diastolic pressure. When you are finished, select Send to send the programmed information to the cuff. The learner will then utilize BPSim to measure the pre-programmed blood pressure reading from a mannequin, simulated patient, or other student. After the learner has gone through the pre-blood pressure measurement steps, such as making sure their patient is sitting with their back straight and feet flat on the floor, they can apply the cuff, noting artery designation for placement accuracy. The manometer should be secured in a fixed position on the black band on the cuff. Using their non-dominant hand, the learner should then secure the diaphragm of the stethoscope head in position in the antecubital fossa, slightly beneath the indication on the cuff. As in future practice, light pressure is necessary, as heavy pressure will obscure sound transmission. Next, using their dominant hand, the learner should depress the bulb to simulate inflating the cuff. Using their thumb and forefinger to rotate the valve on the bulb counterclockwise will release air. Closing the valve by rotating it clockwise will permit air trapping and pressure reading. With the stethoscope placed correctly in their ears, the student will slowly release pressure by turning the valve counterclockwise to permit a fall of 2 millimeters of mercury per second. At the preset values, the student will have the ability to hear the Korsakoff sounds in order to provide systolic and diastolic pressure readings. If the student releases the valve too fast, they will not get an accurate reading, as BPSim provides training in valve release accuracy as well as in blood pressure auscultation. Once the learner has obtained the diastolic pressure, they should fully open the valve to allow for complete pressure release. Instruct your learner to document their findings according to clinical protocols, which you can easily check for accuracy by comparing the findings to the pre-programmed blood pressure. It is our mission to empower future healthcare professionals to improve and save patient lives. Simulate, educate, improve.